Victoria, with 7 new cases overnight. The last time we had less than 100 active cases was the 19th of June. Of today's 7 cases, 6 are linked to outbreaks or known cases, including East Preston Islamic College, Croxton Special School Northcote, the Hoppers Crossing Community outbreak, and Estia in Keilor. One of those 7 cases is under investigation. It's a previous positive, and we believe is likely to be persistent shedding of the virus rather than a new infection. But as we've seen all week, from an abundance of caution, those cases are treated as if they were a positive, and they'll be reviewed by the relevant expert panel at the appropriate time. There are 8 Victorians in hospital, and I'm pleased to say none of those are receiving intensive care. There have now been a total of 3,039,583 test results received since the beginning of the year. That is 17,219 test results since yesterday. Another very, very strong number. All week we've seen really significant community response, both in general terms, but also some of the outbreak management, which is about call to test, asking people to come forward and get tested. That is very impressive, and I want to thank each and every one of those more than 17,000 people who were tested yesterday or in the latter part of the day before. It is critical to us making sure that we've got an appropriate public health response for you, for your family, and every family. Testing and what we do once we get those results essentially stops this virus spreading. So it is arguably the most important thing that people can do. There are 7 healthcare workers who are active cases. The rolling average to 23 October is Metro 5, Regional Victoria 0.2. Cases unknown source, so mystery cases, remain at 10, and they are all in the metropolitan area. In terms of just a little bit more information about those 7 new cases today, those that have been confirmed in the last 24 hours, they're all in metropolitan Melbourne. There are 3 new cases in Darebin and single cases in Banyule, Greater Dandenong, Maribyrnong and Wyndham, so that accounts for the 7. That means there are, as I've said, 98 active cases, 96 in metropolitan Melbourne, and 2 of those cases are in regional Victoria, and those 2 cases are the remaining 2 from Greater Shepparton, which were 3 cases for most of this week. They are the numbers that I need to speak to. I just wanted to make a couple of comments in relation to the Northern Metropolitan outbreak and some of the challenges that we are dealing with there. I had a meeting earlier this morning with a number of community and faith leaders from the inner northern suburbs and indeed the northern suburbs more broadly. I want to thank them for the very proactive, very cooperative way, the partnership that we have with them. They're reaching out to literally hundreds and thousands of people in their own networks, whether they be faith-based or community-based networks, setting up telephone trees, calling upon people to come forward and get tested, making sure that they're just reminding people that if you've been asked to stay in your home, either that pending a test result or because you're a positive or a close contact, that's critically important to do, and that everybody, regardless of your background, everybody's in this together. This virus does not in any way discriminate between different members of the Victorian community, and neither does the government and its agencies when it comes to providing the most appropriate public health response. That reaching out, those calls and visits, there are literally hundreds of people on the ground as we speak, and I think Jerome can speak to this a little bit more in terms of outbreak management and testing. That really important engagement, very personalised engagement, is as much about making sure that people who are confined to their home have got everything they need, whether it be filling a script, getting food for them, whatever the issue might be, and of course checking on their health status and whether there's anything they need from that point of view. We've had about 9,500 tests in that northern metro corridor since Tuesday. There are thousands of results that are still pending, and indeed there will be hundreds and perhaps even thousands of people who come forward and get tested today as a result of deep community engagement and that process of calling people to be tested if they're in any way connected with these cases. That's about a 35% increase on the normal amount of testing we would expect in that local community. And much like Shepparton and indeed Kilmore, I just want to thank everybody from those suburbs who've come forward to get tested. It's critically important. And if you are telephoned or if you are contacted through every conceivable platform and asked to test and you think that that's relevant to you, then please come forward and do that. Do not delay. Jerome can speak to a number of different sites that have been set up. They are convenient, they are secure, they are all about making sure that we stop this virus spreading. Can I also just make some comments about the culturally appropriate nature of this work? I think every second person, so 50% of all the staff and others we have on the ground speak a second language. There's no shortage in any sense of translated material or people to be able to interpret. This is, I think, it is rare for people to need that sort of support. The vast majority of people can speak English and speak English well, but we have that as a sort of safety valve, if you like, to make sure that if anyone does need things to be explained in more detail, then we have the adequate staff, and we have had right throughout this outbreak. Any suggestion to the contrary is simply not right, and it is not helpful to be casting doubt on the adequacy of the response. This is being handled no different to Shepparton, no different to Kilmore. It is being handled very well, but it is a partnership. We can play our part, but community leaders have to play their part, and that's why we're so grateful that they are. And then what's more, individual families and individuals within those families need to play their part also. If you're asked to come forward and get tested, then please do that. And don't wait till tomorrow or Monday. Please come and get tested today. The sooner we get your results, the sooner we can put a public health response around you, support you, get you what you need, keep you safe and the people you love the most, and stop the spread of this virus. That's the most important thing. Now, just before I ask Jerome to speak to some more detail on the ground in terms of those northern metro suburbs and what we want people to do, again, let me thank those community leaders that were on the Zoom meeting this morning. They're all stepping up and doing a fantastic job. Schools that have been involved have absolute gold standard. They've done everything that we've asked them to do. Other faith leaders are reaching out in their communities as a trusted voice, speaking to people about what needs to happen. We're very grateful and very proud of the way the community has come together to support each other and indeed to support every single Victorian, because unless we contain this outbreak, then it will be a challenge for all of us. Just finally, with so many test results that are in the labs at the moment, and with so many people that will get tested today, the results of which will not be known for some time, most likely very late tonight or early tomorrow morning, I just want to caution people from, if you like, banking that tomorrow I'm making a whole series of detailed announcements about opening up. We do hope to get to that point, but with so many thousands of tests that are still being processed, we need to see the results of those tests. Again, I stress numbers are not always the most accurate guide. Almost certainly we will get more cases out of these separate outbreaks. The key point will be tomorrow and Monday and throughout the week, are they linked? Are they cases that can be, if you like, linked? If they're not, if there are no linkages, if they're not linked in any way, then that speaks to the fact that there may be more virus in that northern part of the city than we would be comfortable with. It also speaks directly to the fact that if that is the case, then opening up can see case numbers explode. We have in some respects been in this position before, and we have to do everything we can to avoid that. I'll make announcements tomorrow. I'll fully explain where it is we land, but with so many test results in the labs and others that will be done today, it's really important that we be guided by the data and the evidence and the science. We always have been, and now is not the time, despite the fact we're so close, now is not the time for us to start ignoring when we find significant virus in a given, whether it be in a given community or in a given geographical area. That's not to be, we are still optimistic that we'll be able to have positive things to say, but it's a note of caution. With so much information yet to come to us, we need to be guided by that. That has always been the way. That is what has delivered these low numbers. That is what has seen us go from literally thousands of active cases to now less than 100 active cases for the first time in months. I'll now ask Jerome to speak to the outbreak response, testing, some of those very practical things on the ground, and then both myself, Jerome and Professor Sutton are more than happy to take any questions you have.
Thank you, Premier. Good morning. As the Premier said, we did 17,219 Victorians came forward to get tested yesterday, and my thanks to them for doing so. That is the fourth really strong testing day we've seen over the last week, and this is critical to our ongoing response to finally track down the virus and to aggressively suppress it in its remaining areas. Of those 17,219 tests, 2,802 were undertaken in the northern suburbs. That's a 35% increase on a similar day last week, Friday last week. And again, my thanks to that significant community response that we've seen. It's exactly what we need at this time, as we really tried to get our hands around all aspects of the Metro North outbreak to fully understand any other positive cases we may have within our community. And as we've seen, a number of cases have come forward from that great testing drive yesterday and the day before. And as the Premier said, 9,405 tests in total over the last 4 days in that part of our community. As we currently stand, we have 101 close contacts associated with the East Preston Islamic College. And again, our thanks to EPIC for their fantastic efforts in their very prompt action to close the school on Tuesday and their ongoing support of the entire school community. Those 101 close contacts are all quarantining effectively. They in turn have 307 secondary contacts. All of those are being supported, and all of those are being worked through between colleagues in DHHS and education. We also have 34 close contacts at Croxton Special School, and we're working very closely with them to ensure that they're safe and well settled. There has been one positive case associated currently with Croxton Special School. We also have 4 close contacts that have had some contact with 3 other schools, Dallas Brooks Primary School that we discussed a few days ago, and also Ilham College and Sirius College. At the meeting we had this morning with school leaders and community leaders, again, those schools have been very strong in their support and swift action that they've taken. We're continuing to work with those close contacts and their secondary contacts in turn at those schools to make sure we understand if that outbreak has gone any further into those school communities, and we hope to have more results on that in the next 24 hours. I have to say there's been a phenomenal and a very comprehensive community response to this outbreak. We have literally hundreds of people out there right now. We have had hundreds of people out there over the last few days working with the community to ensure that we can get people tested. Anybody with the slightest symptoms in any part of our northern suburbs, in fact any part of Melbourne and any part of Greater Victoria, should come forward to get tested. They should come and do so today. We now have 15 testing stations across the northern suburbs. 10 of those are our normal routine drive-through and walk-up stations that have been there for a number of months. We have extended all of their operating hours. We've also have 5 additional specific pop-up sites to deal with this additional outbreak. Those details are all on our website. I can go through that later if you like. I've particularly called attention to a drive-through site we've set up today on the EPIC campus, and we're particularly inviting members of the school community to use that particular drive-through testing station. We really want to get you tested today. As well as a general call out for people in the northern suburbs to get tested, we're also asking, as we said yesterday, all members of the school community at EPIC to come forward to get tested, whether they have symptoms or not. It is so important at this time. If you have a child who is a student at EPIC, if you have a member of your family who is a staff member at EPIC, if you have any contact with the EPIC community, we would like you to get tested today, and anybody who you live with in your household. We want to ensure that we have a full understanding of where this virus is going, and to ensure to do that, the only way to do that is to make sure we get as many people tested today as possible. We have a similar request now for members of the school community at Croxton. So again, any students, any staff and their families, their household members, we would like you to come and get tested today. We have, again, the 15 testing stations around the northern suburbs that are there for that purpose. There are, of course, other testing stations across Melbourne that can also be utilised. We will also hold a specialist testing station only for members of the Croxton School community tomorrow at the Croxton School site in Northcote. That will be run by Royal Children's Hospital, and my thanks to the RCH for their fantastic and detailed and careful work in this space. But beyond the testing stations, we have literally tens, hundreds of people out there working with the community. We've had people out there knocking on doors, talking to community members to ensure that if they do have symptoms, they go and get tested, and we saw a great response on the street to that yesterday. We're working very closely with faith leaders and call-outs to their communities to again provide good, accurate and effective information. Last night we met with community leaders across the northern suburbs. We talked about food relief, we talked about contacting people, we talked about getting good and clear information out to people, and there's been some, again, outstanding work done by those organisations. Yesterday we sent out 22,000 texts and emails to taxi and Uber drivers, again across the northern suburbs, to encourage them to come forward to get tested. We've done this before. We remember we did this about a month ago when we had an outbreak in the southeast. It's an effective way of ensuring we get another cross-section of very mobile Victorians in a part of the community, and to understand if there's been any transmission through that circuit. So we are again asking any taxi and Uber drivers in the northern suburbs, whether you live there or whether you normally work there through your normal routes, we'd like you to come forward to get tested today to make sure we can run down any remaining traces of this virus. Finally, I'd like to just really recognise the leadership of the schools and my colleagues in the education department. We have a long-standing close partnership, of course, with our colleagues in education. There is a senior education team that's been embedded in all of our outbreak response for many months now. We work very closely with the school leadership, and we understand, of course, that the schools are in a very difficult situation. When you see a close contact come into your school, or when you have a positive case in your school, it impacts the whole school community. We're working very closely. We'll continue to do so with the school leadership. In fact, today, many of those school leaders will be contacting their families to ensure that they have good and accurate information from a trusted source. We will have DHHS staff providing and supporting them with accurate information, and making sure that any requests that these family members make will be acted upon. Our job at the moment is to ensure we support those 101 close contacts and the 140 close contacts at the two schools, the wider secondary contacts, and to make sure as many of them are being well supported, and that we test as many people in the wider community as we can today, tomorrow, and our urge therefore is please to come forward and get tested. Finally, my thanks to all the community health organisations, the GPs, and really the ground crews on the streets at the moment. They're doing a critically and important job in raising the profile of this important situation, of making sure that people are aware of what they need to do, and the many sources of help and support that are there for them. I'll now take any questions.
Are you confident of having this outbreak under control?
Yes, we are dealing with a number of cases. We believe there are connections that we are still narrowing down between those cases. We're getting outstanding support from the wider community. We're getting outstanding support from the schools. The real evidence will be in the testing results we have over the next few days. It is so important for us to have good, strong, detailed testing results. We saw 17,000 tests yesterday, 2,800 tests in this part of Melbourne. We need a similar number again today. I'd like to see those numbers being sustained over the next few days.
The Croxton School, is there a link there to the original case or to the northern suburbs? Do we know where that case has come from?
Yeah, so the positive case at Croxton School is a student. They are part of a family of four, or that family of four are all positive. That family of four are not connected to the households that we've been dealing with in the Northern Metro outbreak, and we're still trying to establish the exact link, if any, between this new family of four and the wider Metro North outbreak. This family of four have a child at Croxton Specialist School. They also have a child at EPIC.
The family at the centre of the Preston outbreaks that said they were confused about the messaging, was a translator used for when talking to them?
I couldn't comment. What I can confirm is that the family at the start of the EPIC outbreak at the beginning of this week, certainly some of those family members speak excellent English, and we have had an ongoing relationship with them since going back to the 6th of October. So there has been an ongoing daily relationship, contact with that family around the individual cases as the infection has moved through different members of the family, and our information to them has been very clear. We of course understand that there's been some misunderstanding that led to the child attending school on Monday and Tuesday when they were a close contact and expressly told not to, and that child was called in for his day 11 test on the Tuesday.
At the Croxton School, did the student go to school while they were infectious? Yeah,
so the family group that we've identified that's connected to the Croxton School outbreak, the mother was the first case that we identified through a pre-elective test. When we tested her children, the two children tested positive. Those children did attend the school before their positive test.
How many days did they go to the Croxton School?
They went to Croxton School one day.
How much of a risk is that's then going to spread into?
Well, so we apply all of our normal disciplines in this process, and again, very similar to EPIC. So we've worked closely with the Croxton School leadership. They've closed the school. We've identified 34 close contacts of this one child who he may have come into contact with at Croxton School. We're working through that. We will be testing those close contacts and working on any secondary contacts, and we'll continue to support them in that way. The leadership of both Croxton School and EPIC have been outstanding in this space. Those schools are both closed for 14 days, and we'll continue to work with them to ensure we track down any onward transmission of the virus.
East Preston, the drive-through testing, some information went out early this morning saying come and get tested, but it looked like the first people didn't go through till about 11 o'clock. Was there a reason for the sort of delay there? Is it just teething problems of setting up such a testing site?
Look, I wouldn't have thought so. I don't have that information to hand, but we obviously we have mobilised 5 additional testing stations over the last few days. The one that started at EPIC this morning was one of the first of those. Information's been coming out. We've been giving guidance to EPIC families in particular over a number of days now, and of course we're seeing many of them using the rest of our testing network, and we understand that school community is quite far flung across the northern suburbs. So this new testing site is an important asset in our ongoing testing effort, but it's not the only thing we're doing.
Just back on schools, given what we have seen in the past with some schools like Altaka, where numbers have risen quite significantly, quite quickly, have processes changed enough now to prevent that happening again in this situation?
Yeah, look, absolutely. I think if the situation has moved on so much in the last 3 or 4 months. If you look at the attitude and the approach of the school leadership in this case, as soon as the school principal was aware of a close contact on his campus, he closed the school. He made a very clear decision to close the school for 14 days as a really strong preemptive action. The partnership we have with that school is very close and very strong, and there are of course good procedures. The awareness of the children and of the staff around COVID signals, the awareness of the families is far higher than where we were 3 or 4 months ago. So the procedures around that, and of course our first ring and second ring approach. We're now looking at not only the primary contacts, the secondary contacts. That's why we're testing every single family member associated with that school. We're going far harder, far quicker to ensure we capture this virus at the outset.
The other student at EPIC, did they go to school, or the school was shut so they weren't at school?
They were also at school for 1 day prior to the closure of the school.
What day was that?
Monday.
Right. Was there a consideration of hard lockdowns of certain areas or certain housing areas or anything like that in this, or are we moving beyond that now to different sort of situation?
No, so I think if we look at the way that we're responding to this outbreak from its very inception, we are following the contacts. This is not a spatial issue. This is about where are the people. And if you look at the EPIC school membership, it is a very broad part of the northern suburbs. It really covers a very large area. It's very successful. It's a very popular school, attracting children from a very wide catchment. Similarly, when we started working on the original cluster of 6 households, they were also spread over quite a wide area, and we've been managing all of those close contacts within that household environment. What has changed in the last couple of days, of course, is the link now to EPIC. It's the link to Croxton Special School. We're working those linkages very hard. That's why we've taken the decision to ensure we test all the household members associated with both schools. That's the catchment that's relevant to us in this particular case, and we'll provide all the support that they need to do that well.
Just make me go. So in terms of so testing for people that don't have symptoms, what just clarify exactly which schools,
yep,
whether you have symptoms or not, that you can get tested. I think there's a confusion over whether you have to have symptoms or not. So where can people who don't have symptoms go?
Very happy to keep clarifying that. Yep. So any family member associated with East Preston Islamic College or Croxton Special School should get tested, full stop. Come and get tested today, come and get tested at any site in the Melbourne area, or come and use the pop-up sites that are set aside at that school. If you can't reach one of those sites, please contact us on the COVID hotline, and we will come to you and get you tested at home.
Social housing block, 120 people put in isolation in Broadmeadows. Have
Yep.
you got the results back from there? Have there been more cases there?
No, so we tested 86. We had 86 people tested in that housing block a day and a half ago, 2 days ago. All those results came back within 18, 20 hours. All those results were negative. There is a team that's continued to be on site, and we tested, I think, half a dozen people yesterday. Those results were all negative as well, and we continue to support that block. But it is not an active part of our ongoing outbreak management. We're now very much focused on the schools network to make sure we capture it that way.
Is there testing happening at other social housing towers as well?
No,
I saw some.
no. So we are following up. As I said before, we have a number of close contacts and secondary contacts associated with the schools that we're focusing on. Some of those family members live in all sorts of housing. Some of them live in public housing, some of them live in community housing, many of them live in private accommodation. We are increasingly doing door-to-door testing for them, so we are going to them to ensure that they're getting the care they need, the support they need, but also that they get tested.
Are there any concerns that schools may have opened a little bit too early, or are you confident that this
No,
will
I think if I look at the response of the school leadership of the schools we're dealing with in this particular outbreak, it's been exemplary. They've taken swift and prompt action. Bear in mind, we're talking about cases that happened on Monday of this week. We've been talking about with yourselves about this since Wednesday of this week. It's a very, very rapidly moving situation. In that sense, it's very different to situations like Shepparton, where we were catching up events that had happened weeks before. This is one that's very new. It's moving very quickly, and we're moving very quickly to get ahead of it.
Do we know how many families in the Carlton, North Melbourne, Flemington towers send their children to the East Preston school as well?
So we've certainly have identified where the 101 close contacts and the 307 secondary contacts, we've identified where they live, and they are, as I said, all across the northern parts of Melbourne. There will be absolutely a handful of those in the Flemington area. We're not tracking this by housing location. We're tracking it by people and their association with the school. Remember, this is all around close contacts at the school and their secondary contacts. So we're taking a much bigger sample, a much bigger slice of the population to ensure that they're supported, that they're isolating effectively, and that we test them properly.
Granny, can I just ask, given Joanne said the importance of the test results coming in over the next few days, how difficult will it be to make your decisions this afternoon on easing restrictions and announcing things tomorrow, given that uncertainty?
Yeah, I think it'll be a very late night and a very early morning, so that we can get as many results on the table, as it were, so we can have the most complete picture available to us when we make those decisions. We really do just have to wait to see what those test results show us. So we know there's thousands that are in the lab now that'll be processed today and will come to us later on this evening. Fairly late though, and then there'll be all of today's testing which will come to us tomorrow. So we just have to look at that very carefully. And what we are hopeful of is that there are connections and linkages between these cases, and these cases don't speak to the virus being in the northern suburbs more than we had thought. So it's all about trying to find those linkages, and that's why there is a very big team of people interviewing, re-interviewing, looking at things from every conceivable angle to try and find linkages. But if they're not there, then that'll be of concern to us. Volume will also be an issue, but as I've said many times now, when you get down to these very low numbers, it's the story behind the case that's just as important as the case number.
People were really pegging their hopes on some big announcements tomorrow. It almost feels like deja vu. What's your message to Victorians?
I wouldn't describe it in those terms. We are in a very good position, and if we can proceed tomorrow, we will. But I think it would be. I don't think many Victorians would think very highly of me making decisions or public health team providing me advice while there were literally thousands of cases from a part of Melbourne where we have seen a series of clusters and a series of outbreaks. Basically, for me to ignore those tests that are sitting in the lab, that doesn't make any sense at all. So we have to wait and see what those results are, and we will get a more complete picture today and hopefully the early hours of tomorrow morning, and then we'll be able to make some judgments from there. These numbers are still low. We are still Metro Melbourne at 5 cases for the 14 days. Literally no cases in regional Victoria over the 14-day period. We're in a strong position, but I think having and just go back to the point. I'll just go back to the point Jerome made. So all those schools need to come forward and get tested. So it's staff, students, everybody in a student's household, so mum, dad, siblings. We're ringing, and schools are helping us do this, so the schools are ringing all of their people on their database and talking to them about what they have to do. So it's a massive effort. Those people will get tested, and we should wait for the results. I think that's probably the best way I can answer your question. It would be wrong to call people to test and then make decisions without having looked at those test results, and we'll do that as fast as we possibly can, and we'll try and, well, we are doing and we'll continue to do throughout the day, all of that coronavirus detective work to try and find linkages if they are in fact there.
Is it worth perhaps, I'm not telling you what to do, but is there a chance you could delay tomorrow's announcements?
We will need to see what happens with the test results that come back to us today. I'm just trying to be as frank with people as possible. I know a lot of people had banked tomorrow as being a day when we'll be able to have absolute clarity about what the rest of October and November looks like. If we can do that, of course we will, but the appropriate thing to do is, if you've got thousands of tests in the laboratory being processed, you've got cases from where those tests are coming from, you have to wait to get the results.
Premier, given you have flagged significant changes to be made tomorrow, and we have now hit that rolling 14-day average of 5, which is the goal on your roadmap, if the northern suburbs is now posing a bit of a threat, if I'm hearing that correctly, can't we have a more targeted approach to that area and let the rest of Melbourne sort of get on with things? We have a lot of industries, retail and hospitality, really relying on the announcements being made tomorrow. Sure.
Well, this is a very targeted approach. So what we're doing is we are essentially asking people that we've not previously, I don't think many other parts of the country have asked people, cast the net this wide and said, right, you've got to get tested and you've got to stay at home until you get those test results. Now, they're all links in a chain, and if someone back closer to the case than you are tests negative, then that link is broken, and then that family or many hundreds of families can go about their business. So this is absolutely a targeted way of doing it. It's people that have got any linkage to a case, primary or secondary. That is a very targeted way of doing this, and this will be a feature of what opening up looks like. So hundreds of people, maybe even some thousands of people, will be confined to home, so that hundreds of thousands, indeed millions of others, can have can get back to work and can be open. That's the most targeted, the most localised, and the most, I think, risk-based way of doing this. Beyond that, we just have to see what these results tell us. And it's not so much, I know this is a bit of a counterintuitive point, the numbers are not such the issue. If they're all connected, if they're all linked, then, and you've got containment around them, then that's a much better situation than even a smaller number where there's no apparent link between those cases. Because what that tells you is that in the northern suburbs of Melbourne, just to give one example, there is virus that's bubbling around, and that you've then got to make those really difficult judgments. If you opened up knowing that, what's the potential for the thing just to, finish up in a situation where there are many cases.
Could we see a return, though, to earlier in previously, months ago, we had sort of hotspot suburbs locked down?
I don't think that's going to be the appropriate response, but we'll look at it. We'll look at all those things based on the results we receive later today and into tomorrow. Ultimately, unless you have no movement out of a dedicated or a specified geographic area, then that doesn't quite work. The better way to go is to say, okay, here are a group of people, albeit quite a large group, and their contact may be passing, if any. But because there's a linkage of any sort, all of those people, secondary contacts, primary contacts and cases, we lock them down rather than locking down a whole suburb. That I think is the best way to go. That's what's worked in Shepparton, that's what's worked in Kilmore, that's what is currently being applied in the northern metro region, and that's exactly the way that we'll continue to go. It's just at hundreds and thousands of people that are confined to their home while we get them tested. That allows hundreds of thousands and millions of other Victorians to be open. That's the logic to it. It's working well. It is a massive task, and there are literally hundreds and hundreds of people that are out there on the ground at the moment, and there will be thousands of people who get tested today. We just have to wait and see their results.
What's the compliance rate like with people? Are they if someone rings up and says you should get tested, are people generally saying, okay, I will?
Yeah,
or
I think
is
so.
there a bit of
I think it's
pushback,
a
or
very...
You can't compel people to get tested, obviously.
Well, ultimately we need people to... We can compel people to stay in their home, We can, in very rare circumstances, compel people to get tested, but that's a very
That's
a
not
very
happening now,
challenging
though.
thing.
Compelling people to stay at home is not happening now, though, is it? Or when
For
you say
some people, it will be if they're a known contact. It's the answer to your question is, by and large, the vast majority of people are no problem. I'll go and get tested. But the best way to do it is, rather than just the government telling people what to do or asking people to do certain things, if you can engage community leadership as well. And back to the point I made before, principals, faith leaders, community leaders will literally be calling each of these families today. Some of this has already happened, but they'll be calling each of them today saying, right, you've got to go and get tested because you're part of our school. You may not have it, but you're part of a group of people that may well be connected to this case, or in this case, a couple of cases. I think because it's not just us doing the asking, but it's other really trusted voices, people that are known, people that are part of that community, and people who are genuine leaders. I think we're seeing extraordinarily high levels of people coming and doing that. And the mere fact we have so many more tests, 35% more tests in that part of Melbourne, I think is proof of that.
And can you cross-reference who has got tested with who is being requested to be tested, or is that a bit too...
No, I had a conversation this morning. I think Jerome and I went into some detail with some of the school leadership. So they've gone through already, and they've booked in family by family to come and be tested at the site that's on the testing station that's on the school grounds. They're going to work through all those different appointments, and then that will give them a list of people who didn't show, and that's not a criticism. They may have gone somewhere else. Circumstances may have intervened, but they'll then go back and do that for a second time, a third time. We're really confident that we'll get all of those people. They will come and get tested, and then we'll get their results as fast as possible.
Can I just ask you about the 25-kilometre limit at the moment for travel? What advice are you relying on to look at whether that gets lifted or not? I mean, what are the sort of measures to lift that or get rid of it altogether?
Yeah, so this is one part of a package of different rules that are in place, as we know, and it is very difficult to attribute the kind of percentage public health benefit or dividend to that particular measure. What it is principally about is making sure that, for instance, say you've got a problem in the north, we haven't got people in the north travelling literally to the other side of the city, potentially taking the virus with them. It's also about making sure that some of those very popular spots, whether it be the Mornington Peninsula or the Dandenongs, we don't have de facto crowds. People won't know each other, but they'll go there because they're such beautiful places, and it's not unreasonable to expect that people would head to some of those places, and then you finish up with many hundreds and indeed thousands of people gathering together. That's not safe at this time. However, overall conditions, amount of virus, mystery cases, all the things we've talked about literally 1,000 times, they'll inform whether that needs to stay in place for longer, and if so, for how long, as well as the metro regional border also. So those things are absolutely on the table, and I would hope to be able to have more to say about both those elements and many other rules when we make hopefully some announcements tomorrow.
We've seen how complex contact tracing is. Do you think getting workplaces to take on a bit of that role with contact tracing puts on too much pressure on them, particularly they lack the expertise and the knowledge?
No, I saw some reports today about this. What I can tell you, let me give you the example of what's happening in the north today. So people in my office and people in the public health team are ringing employers right across the north, particularly larger ones, and they're saying, righto, you've got to reinforce this messaging as well to your staff, customers where there are customers and you're open. The last thing we want is anybody who's kind of caught up in this or got symptoms more broadly, or a contact of someone who has this virus turning up for work. So that partnership approach, there'll always be a role. If you look at it, why is the contact tracing so much better in terms of this northern Melbourne outbreak today than it might have been, say, 6 or 7 months ago? Well, the schools are fully engaged, they're providing lists, they're making calls for us. They're actually ringing parents and saying, right, you're in the loop on this and you need to come and get tested. So the same applies for any employer, large or small. It's not a matter of them doing it on their own. It's a matter of them helping us to do this important work. And after all, I think that most businesses will have an infinitely more accurate sense of who works for them and who's visited them, who's been part of their business, than what any public health official would ever have. So it's just about everybody working together, acknowledging that we all get a benefit from tracking and tracing these cases and locking them down fast, and therefore we all have to we all have to play our part in that.
Premier, a while back this week you said that the existing contact tracing system, Victoria's existing system, was working in parallel with the changes or the revisions that you've made to the system. There's been some dispute that they're actually being merged. You say they're running parallel. Can you just explain that a little bit more?
Whenever you move to a new IT system, for instance, so I'm told by people who are expert in these matters, you run the old system and the new system side by side. Over time, they finish up merging because, of course, all the data that's in the old system migrates across to the new one. But whenever you have any new system, whether it be in a home office or a really large data undertaking like this, you've got to have the redundancy of having the old system still going. I'm not aware of any issues with that. That's just the sort of custom and practice of the way that IT systems work. So I'm told.
Where are we up to today, would you say, with that parallel or merger? Where are we up to in that system?
I'd need to get you a daily update. I'm more than happy to do it, but that Salesforce system, that CRM system, together with the other defence science product, they're all on schedule, they're all working well. And what it'll mean when it's finally done, that we'll have that kind of end-to-end picture, so that no matter where you are in the state, if you're part of our public health response, you'll be able to see and have that kind of instant knowledge of what's going on everywhere else. That's critically important, and certainly becomes really important once we take further steps.
On restrictions and waiting for tests, you're saying you're waiting to get some results back today, but realistically we're probably going to be getting results from the northern suburbs for days, are we not? Is there kind of a point in time in the week where you'll realistically have an idea of what's going on there, do you think?
I think that given that we've hit this pretty fast, and I think there'll be quite a substantial amount of tests that come back to us tonight or the early hours of tomorrow morning. That will be probably greater than the amounts of testing that will come to us in subsequent days. We can't be certain of that, but I think we'll get a pretty good update, if you like, Michael, from the tests we'll get back today. It's not the end of it, though. You're absolutely right to say that there will continue to be tests that will need to be done and results that will need to be analysed and interrogated for many days to come. That's just the nature of these things. You know, we look at this in terms of intervals of, well, we call it a day 3 test for a reason, because that's the appropriate period to wait. Then there's a day 11 test, so this will be with us. These cases and the risk will be with us for some time, and that's where there'll need to be some very difficult and quite finely balanced decisions made tonight and tomorrow, and indeed throughout the course of the week.
It was reported today that retail shops were given a heads up they could start potentially doing this dark reopening tomorrow. Is that true, and is that going to be put off now?
Well, I'm not interested in having a quarrel with anybody about what they may or may not have been told, but I've been abundantly clear. When I stand up here and make the announcements, that's when people can start planning for it. Beyond that, I think there is a risk of preempting whatever it is we announce. It is our hope that there can be that dark opening where we make an announcement on one day, but the changes don't come into effect for a couple of days later. And then there's also the notion of making sure that staff, owners are indeed permitted workers for the purposes of that opening. And that opening form has two parts to it. There's obviously getting the shop ready, whatever that might be, getting the business ready, but it's also getting the business COVID safe. So it's very, very important work. But no one should be assuming that I'm making announcements and what the nature of those announcements are until they are in fact made. Because what the northern suburbs shows us, what this whole pandemic has shown us, is this thing moves silently, rapidly, and things do change quickly.
You were saying these cases and the risk will be with us for a while still, these tests still come through. Is it really realistic that a place like Northland Shopping Centre is going to open up in the next week, in the next 2 weeks?
Well, I don't think it's appropriate at this stage to make judgments one way or the other. We need to work through these numbers. We need to understand them. We need to find whatever links are there, because obviously cases that are linked together are in an entirely different category to cases that aren't. One speaks to containment, and the other phenomenon speaks to the notion that there is virus out there at greater levels than we had thought and hoped.
That's it's got to be a miracle to have low numbers tomorrow then, considering how many tests you've got.
No, I wouldn't say that. I wouldn't say that. We've got, we've done, I haven't got a weekly total, but we've had a very, very strong week in terms of tests, right back to the weekend. And we've turned up relatively low numbers of cases this week, and the vast majority of those cases have been linked to other known cases. So it's Dad's got it on Monday. Mum and the 3 kids are all locked away, and then throughout the course of the week, the rest of the family finish up testing positive. That is a very different set of circumstances to 2s and 3s and 4s that we can't, for the life of us, all the work you do, interview, re-interview, all the stuff, we can't find linkages. They're 2 very different things.
Premier, are you just able to clarify something for me, just in terms of the current
I'll
situation
certainly try.
with private security guards in hotel quarantine at the moment? I understand there are quite a number of workers from other industries, not the security industry, other industries that are currently stood down, and quite a number of people who are currently on JobKeeper from their regular jobs, employed by the government at the moment as private security guards in the quarantine hotels. I understand they're on contracts to the tune of about $120,000 a year, but to date, this has been going on for the past few months. They've received no training, and many of them haven't done a single shift. They're sitting at home earning this money for nothing, basically. Is this true, first of all, and how many people does the government have signed up on these contracts, and how is this justified in the current economic climate?
I've been asked this question a number of times, and my answer, I'll need to get the Attorney-General, who is in charge of this program, to come back to you with as much detail as she can give you. We have a standby workforce, and it's appropriate when you've got highly skilled people that you've got them there ready. We will have flights back on the ground as soon as we can, and we have to be ready to make sure that we can do that. In terms of the numbers that you put to me, I can't confirm that. The only thing I can do is refer you to the Attorney-General, and someone from my office will be more than happy to get answers to any and all of the questions you've asked.
Can we get a timeline on that, Premier, and also...
A timeline in terms of when flights come back? No,
a timeline in terms of how long this has been going on, how many people, and when we can get some answers to this, but also just how is it that they still haven't received any training, given what we've had in the problems that we've had with quarantine hotels in the past? Well,
I'm not certain that they've not had training. I'd need to find that out. I don't know the answer to that
My understanding is they haven't had any training as yet.
Well, and there's also an understanding that people are on JobKeeper. We don't pay JobKeeper. That's paid by the Commonwealth Government, and we have no influence over who gets JobKeeper and who doesn't. But on the specifics you've raised with me, absolutely happy to go and get answers for you, and I'll make sure that my staff speak to the Attorney-General and the Corrections Commissioner who is running the program. This, I think, almost exclusively, if not exclusively relates to a program that is stood down. I think that's the point of your question, and we'll be more than happy to get the answers.
Do you have a number on how many tests you're hoping to get back tonight in regards to that northern suburbs area?
I'd be very bold to try and predict that. I think that if you look at the trend across the week, we've been in the high teens every single day. Now, weekends normally drop off a bit, but given the amount of work we're doing, literally us and community leaders ringing family by family by family, asking them to come and get tested, I would expect we'll have a very solid testing number tomorrow. The most important thing is that we get the people that we need tested. That's a relatively small number in the scheme of the whole state. That's not another 17,000, Michael, but it'll be hundreds and thousands of people. And the really important thing is to work through one by one. So you guys reporting it, that's really important, sending that message out more broadly. But the really targeted stuff where the principal of the school and half a dozen of the senior teachers are on the phone calling class by class, that's the really important way to go here. And that work is happening as we speak.
In regards to that messaging, we've spoken to a Melbourne GP. She says she's treated about 100 COVID patients from multicultural backgrounds. And she says not a single one of them has received messaging in a language other than English. I know you've mentioned that 50% of your contact tracers speak a language other than English, but is that messaging actually getting out there?
Well, I'm not sure who that GP is and what community she's talking about or what period of time she's talking about, but it's simply wrong to say that there's not translated material, and where an interpreter is needed, that interpreter service is offered. We have reached out and enlisted the support of so many different multicultural communities, so many different faith communities. It is one of the reasons why these numbers, I'm not standing here reporting thousands of active cases. We're reporting for the first time in months less than 100 active cases. You'd always look to improve, though. Every single day we always look to do better, but it's simply wrong to suggest that there is not detailed community engagement, really localised community engagement. We know that our multicultural and multi-faith diversity is one of our greatest strengths. It can also from time to time present challenges, but we're all equal to that challenge, and that's why there is a massive team of people who are out there communicating with people in any way, using every platform to get the messages out there. I just don't think those criticisms are fair or accurate. But if there's specifics that GP wants to put to us, we're always happy to follow it up, because we're not about being stubborn about these things. If there's a room for improvement, if there's a gap there somewhere, then we're always looking to try and do better.
Last question.
Communication breakdown that happened with this family for the student to end up at school. Have you worked out how that happened?
Well, look, I just want to make the point. We have very rarely have we called out people who have done the wrong thing. Very rarely have we sought to sort of cast blame. But that is a complex set of arrangements in that particular family. It's been interpreted as there was confusion. I think that we made our position abundantly clear, but it turned out that the child went to school. None of us can change that, but again, a bit like the question I just answered, we always try and learn from that, and if there's a terminology issue or if there's a need to make 4 phone calls instead of 3, then that's what we do. But I'm not accepting of this notion. I've been well briefed on this. I'm not accepting of this notion that somehow the response of our dedicated public health team was not complete or it was not done properly. We went to every effort, and we are confident that we did communicate. But the child went to school. We can't change that. All we can do is work with that family and every family that's touched by this. Not only send our best wishes to them, but put a public health response around them to keep them safe, and then use the school community as we are. They're doing an amazing job. The principal, Ekram Ozirek, who I spoke with this morning, his team, all the principals of all these schools, faith leaders well beyond the school, they are literally working through list after list, ringing people today, and it's an absolute credit to them. And I'm very confident that when people get those calls, they will make a proactive choice to come and get tested, and they'll do it fast.
Sorry, are you saying the directive to not go to school was ignored effectively?
No, what I'm saying is the notion that the family were not advised appropriately of what to do is not accurate. But it didn't get through. Obviously, there was an issue. The child went to school when we all would have preferred they didn't. We can't change that. But the notion that whenever something happens that ought not to have happened, that's somehow a fundamental deficiency in our public health response is not fair on the thousands and thousands of people who are out there working tirelessly to get these numbers down. And their work has seen these numbers come down, and indeed the work of every single Victorian family.
Premier, before you set up hotel quarantine, your departments and ministers received a letter from the Victorian Government Procurement Board warning that at a time of emergency, and I'll quote, there's a chance of unscrupulous or ill-prepared suppliers offering contracts with the Victorian Government, and warned departments to be vigilant. But 3 days later, the Jobs Department led a contract to Unified Security for $30 million. They were not on the vetted list, they were not on the pre-approved list, and this is in contravention with the advice or the warning given by the Independent Procurement Board. Does that concern you?
Well, I'm concerned to have answers to all of these questions and many more. And that's why the board has been set up, and that's why the board is doing its work. And given that that particular security firm was a party that had legal representation at the board, I think evidence, again, don't quote me, but I understand that there was quite a lot of mention made of that particular company. I'm not making a judgment either way, but I think they were part of the unfolding story and the recounting of what had gone on here. So I'd be very confident that some of those issues will absolutely be in the minds of the board and may well be part of the findings that the board comes down with.
Does it concern you, though, that the Victorian Government Procurement Board required by January last year, so 2019, that all the major departments in the Victorian Government have an independent procurement unit? The only department that doesn't have an independent procurement unit is the Jobs Department. The Jobs Department, is 18 months down the track where they should have an independent unit. They don't. And they were actually put in charge to be the lead agency for critical procurement at this time, in breach of your own government's commitment that everyone would have this independent unit set up by January last year.
Well, again, these matters are, I think, very much under the active consideration of the board, and they will have already and will continue to turn their minds to what, if any, findings they need to make, what, if any, steps they need to recommend.
But your independent procurement board has not given a submission to the Coate inquiry. In fact, when they followed up with your government, they wrote a number of letters to ministers in the Treasury portfolio. They wrote to Simon Femister in September, concerned that the Treasury and Finance submission in relation to procurement went forward to Coate, and they were only told about it after the event.
Well, if you're putting it to me that Justice Coate and her team are not adequately, are not in a position to make judgments about that procurement process, then I don't think that's accurate.
No,
I think
it more
they
relates
have
to the notice to produce that was given to your Department of Treasury and Finance, and that they submitted to the Coate inquiry information about procurement without going to the Independent Procurement Board, that they were told after the fact, and that the Independent Procurement Board wrote to your minister on the 1st of October, wrote to Simon Femister on the 4th of September, are quite exercised that they gave a number of warnings throughout the year in relation to the letting of contracts, and that they were not then included in the Coate submissions.
Well, as I said to you, I don't think it is accurate to say that the board is not well placed to make judgments about processes that were adequate or otherwise when it came to the letting of contracts.
Why was the Procurement Board excluded from the Coate
I'm not in a
submissions?
position to answer that. What I'm saying to you is that I think that regardless of that point, this Board of Inquiry is uniquely placed, having gone through many, many documents and having heard much evidence on this very point.
They haven't got these letters in their evidence.
Well, that's a matter for them. I'm not agreeing with your contention that the board somehow needs a letter from that agency in order to make a decision about the adequacy or otherwise of procurement processes.
But
they
this
have spent
board is-
enormous amounts of
The
time.
Procurement Board is your watchdog for how public money is spent, and
Well, I
it's
don't
not
know that
been
you
included in...
I don't know that you necessarily would describe them in those terms. They've got many
you've
different.
got press releases
They've
from
got
your
many
ministers who
different.
describe them
They've
as
got
a
well. If you
watchdog.
let me finish, I'll finish. They've got many different roles. I think I've answered your question a couple of times now. I do not concur with your conclusion that the board is not well placed to deal with issues of procurement, the suitability or otherwise of processes, the suitability or otherwise of people who won those contracts. All of those matters have been, I think, they've been extensively looked at, and it'll be for the board, who I think are well placed, to be able to come to conclusions or not, as the case may be.
Ask Professor Sutton a question.
Yes.
Certainly.
In regards to restrictions and the possible impact of this outbreak on the reopening of things, how do you think it's going to impact it? Is there kind of certain aspects of the reopening that could be changed by this and some could still go ahead, or is it just going to be a blanket potentially pushing them back?
No, I think we make considerations as to exactly what we get in the next 24 hours, or a bit less, in fact, in relation to this outbreak. We don't know what that's going to bring us. I think the response has been terrific, and I'm actually very confident that we'll get control of the active cases that are related to this outbreak. But as the Premier spoke to, it is those cases that might be unlinked, that might be turned up by very substantial testing, that will need specific consideration, and that will obviously be reflected in how we think about restrictions as well.
Professor Sutton, there are allegations that you instructed lawyers to withhold key emails from the hotel inquiry. Do you stand by your evidence to the inquiry?
So I'm not going to comment on the inquiry. The Board of Inquiry will have a notice to produce for me, I think, in coming days, and it wouldn't be appropriate for me to comment until then.
Regardless of this northern suburbs outbreak, our mystery cases in the last fortnight is still at 10. Is that an acceptable number?
I think we're happy in the general trend with mystery cases. There's only been a couple in the last 7 days, so a lot of those 10 are earlier on in the fortnight period, and there's still a few of them that I'm actually quite ambivalent about whether they're genuine cases. We've classified them as such. We take a precautionary approach in that classification, but they might be false positives as well. So the number doesn't concern me too much.
Professor, given the allegations against you and the fact that you are still our Chief Health Officer and making some very key decisions in the coming days, isn't it fair that Victorians deserve some answers a little bit sooner than having to wait in terms of whether or not you do stand by your evidence to the inquiry? Well,
no, it's not appropriate for me to run a commentary prior to the inquiry process. That would be inappropriate for me. The notice to produce I expect very soon. I will cooperate as I have always done, and they'll have their determinations very soon.
That's just whether or not you stand by your evidence, though.
I will make those submissions to the inquiry, and that will be available.
Professor Sutton, can I talk? Sorry. No, you go.
Professor Sutton, I want to go back to something you said on the 13th of May. It relates to the Cedar Meats closure. On the 13th of May, you said if you'd known about the Cedar Meats infections, you would have shut them down sooner. And it really became apparent about the 27th, 28th of April, and they were shut down by you on around the 29th of April. I'm just curious, when you said you'd shut them down if you'd known, that on the 22nd of April, so a week earlier, there were a number of half a dozen or so Cedar Meats workers that were identified as being COVID positive, and they were put into hotel quarantine at the Ridges, and they were there for a week before Cedar Meats was actually shut down. Can you explain the discrepancy? Because clearly they were known as positive cases. Ridges at that time was used for returning travellers basically only, and this was a cluster of workers from Cedar Meats, but it took a week to shut them down.
My recollection is there were only a few cases when that was raised with me, the shutting down of Cedar Meats, and I gave my advice at that time to shut it down completely. So that's my recollection.
But how was there 7 workers actually identified from Cedar Meats and put into Ridges under the say-so of your department or your Deputy Chief Health Officer at that time? And I've got a copy of the documentation they had, isolation, diagnosis, directions number 2, and a whole lot of paperwork that was incoming. I've spoken to the security firm who was operating Ridges at that time. This is a week before you took the action to shut down Cedar Meats, and you knew there were 7 workers at Cedar Meats who were moved from their homes to Ridges. So why did it take so long to shut down Cedar Meats?
No, I'm saying I shut down Cedar Meats as soon as I was aware of those cases.
But Annalise Van Diemen made this direction for these 7 workers to leave their homes and go to Ridges, and she's your deputy. How does the one hand not talk to the other hand?
I'll have to come back to you on exactly what you're referring to, because I haven't got that information in front of me.
It's all in the documentation that's before the inquiry.
Yeah, and I'm happy to look at it. Anything else?
Any other issues?
Thank you.
Yeah. On the testing with these people, they do their day 3 test. Who then stays in isolation to do their day 11 test? Who is allowed to leave isolation?
So
after
all of
day
those
3?
primary close contacts have to complete their 14 days of quarantine. So they're the individuals who've been in close contact with the confirmed case. And from the time of their last contact with a confirmed and infectious case, they have to complete their 14 days of quarantine, regardless of those test results. It's their close contacts, the secondary close contacts, who can be released from their quarantine if there's that day 3 test.
What time will we see you tomorrow?
Whenever it's called. Thank you.
No other issues? If you've got any symptoms whatsoever, please go and get tested and do it today. There's arguably nothing more important. Thanks very much. See you tomorrow.